we are doing the acute inflammation. Firstly, vascular events. The vascular event is actually microvasculature alteration. Micro means at a smaller level, vasculature means vascular things, blood vessels, and its alteration. That is, you can see in the bracket it's written arterioles, capillaries and venules. So first, in vascular events we have hemodynamic changes. What all we will cover in hemodynamic changes is vascular flow and caliber of small blood vessels. First comes the transient vasoconstriction. What happens is when there is an injury, there is a vasoconstriction so that the blood flow is remain constant. See, the constriction of an arteriole takes place. Next is persistent or progressive vasodilation. First, there is a kind of a reflexive action of constriction. Like at the same instant the constriction of arteriole takes place, within half an hour there is vasodilation, progressive vasodilation, which is responsible for redness and warmth. Obviously, any inflammation is related to color, pallor, pallor and dolor. We all know that. Next is, what is hydrostatic pressure? Hydrostatic pressure is the pressure through which the particles move outside from a blood vessel or a tissue. So this is a tissue in which local hydrostatic pressure increases due to injury. Therefore, more of the fluid accumulates here and causes inflamed or swollen tissue. Now next comes the slowing or stasis. The RBC, the arterioles, in the arterioles or the capillaries, the RBC, number of RBC increases, which will raise the blood's viscosity. Now we all know that at any site of injury, leukocytes will have to come there from the neighboring places. So leukocyte starts to margin from the blood vessels. They margin towards the end of the blood vessel wall. This is called the red line flare wheel, which is triple bonds. What is this? I'll tell you. First, there is formed a red line, which is an injury. Then flare is the redness, which we learned the persistent progressive vasodilation. So redness demonstrates this, and the wheel is movement of leukocyte towards the margination. Now, in the second part of the acute inflammation vascular events, we have changes as permeability. So let us revise what was first one. It was hemodynamic changes. So now we need endothelium lining of musculature to become a less leaky, because due to what happens due to the injury, it becomes leaky. So condensation of endothelial tile. There are temporary gaps mediated by histamines. The histamines at the site of injury causes temporary gap. There is also concentration or mild endothelial damage takes place. This is obvious. Whenever there will be a needle which pricked a tissue, then there will be endothelial damage. Direct injury to endothelial cells, either the tissue damage or direct injury to endothelial cells, which causes cell necrosis or thrombosis. Leukocyte mediated. At the site of inflammation, there is presence of leukocytes. The activated leukocyte release proteolytic enzymes and toxins, which increases the leakiness. Leakiness, neovasculature. Neo is even smaller than micro. So leakiness at the level of neovasculature. Vascular endothelial growth factors causes the leakiness to become even more leaky. Thank you.